My patient that I cared for is a 70-year-old Army veteran who suffered a traumatic spinal cord injury in August of this year due to an ATV accident. His injuries included a C6 to C7 fracture dislocation, a left vertebral artery injury, a traumatic garotomy, which is an injury in the derma mater, which is the outer membrane covering the brain and the spinal cord, a left radius ulnar fracture, a severe left forearm lacerations, and rib fractures. A particulate determinant are the objective and physical data. So with his injury, his hand and finger function are impaired, but the wrist extension is preserved. So monitoring of his respiratory function is needed to the compromised area of the injury. He is also at risk for autonomic dysreflexia and has a bowel and bladder dysfunction. This paradigm is the foundation for his rehabilitation, which is grounded in evidence-based science and safety. Integrative and interactive is the relationship between the patient, his family, and the healthcare team. That includes the patient, his family, the nurses, PT, and OT that work with him, the psychologist, the social worker, and his providers. Adaptive equipment has been furnished to him through the VA. I know that he and his wife have purchased a one-level home to accommodate him, and some modifications will need to be made to the house. Psychosocial support is integrated into his care, as this is a life-altering event for him and his family. He is having to negotiate his new life, relationships, and his independence. He has a very supportive wife, children, and grandchildren. They visit often to see him. Adaptation, communication, and partnership are key highlights of this paradigm. Unitary and transformative is where his identity, meaning, and purpose are reshaped. This has allowed me to see him as a whole person, not just a patient. His injuries were a disruption, but also a transformation for him. His identity is reshaped and he finds resilience and purpose in his life despite his injuries. I practice with him, listening to his hopes and fears. He does not view his injury as a loss, but rather as a new vantage point for advocacy. His spiritual growth and relationships are being deepened. I created a healing environment by building trust with him through active listening without any judgment. I made sure that things were cleaned up in his room, making sure everything was in its place and accessible to him. I assured a healing presence by practicing intentional presence, slowing down during interactions to fully focus on him rather than rushing through tasks. I used nonverbal communication by having good eye contact with him and by being silent when it was needed for him to think through what he wanted to say. For the ways of knowing, I chose empirical, ethical, personal, aesthetic knowing. I integrated Barbara Carper's ways of knowing into my practice. With empirical knowing, evidence-based interventions involve monitoring his respiratory function and preventing autonomic dysreflexia. With ethical knowing, I upheld his right to participate in his decisions and maintain his values and dignity. Personal knowing is built through trust, fostered by presence and empathy and a genuine nurse-patient relationship, which acknowledges my own humanity and caring relationship. Aesthetic knowing is where routine interventions are transformed into a holistic healing environment. I lived human caring by embodying Gene Watson's philosophy of nursing as both an art and a science. I did not see him as a diagnosis, but as a whole person. I live with human care centered on compassion and dignity and expanded my consciousness by reframing this illness as a transformative experience. I integrated the ways of knowing to provide holistic and evidence-based care. With the character's process, I chose first embrace. I approached him with unconditional compassion, recognizing his humanity beyond his injury. I assured him that he was valued and respected. I practiced trust by being fully present during his times of vulnerability. This was intentional as slowing down allowed me to be truly present with him. Using nurture, I built a trusting and caring relationship with the patient and his family. Using balance, I educated him and his family about autonomic dysreflexia and the complications that could occur. The last is minister. This is a basic care that is treated as sacred. I treated acts such as his bowel program and bladder program by performing this with compassion and respect. By living the Caritas processes with the attitude of compassion, gratitude, and appreciation, a healing process was created. He felt seen and valued, while I, at the same time, gained a deeper understanding of my practice. For holistic healing practices, this was also addressed on my previous slides. I use grounded, evidence-based practice, monitoring his respiratory status, safeguarding against autonomic dysreflexia, managing his bowel and bladder program, and ensuring safety and clinical accuracy. At the same time, respecting his autonomy and dignity by feeling respected in his goals and listening to him. I built an authentic relationship with him by listening and validating his concerns and experiences of his sudden disability. Through aesthetic knowing, I utilized the art of nursing and creative adaptation to his care, employed in positioning strategies for comfort, and utilized assistive devices that provided growth opportunities. Using collaborative care was central throughout his care. I worked with this team with whom I had contact and shared his decision-making processes with me. I was present and advocating for him while also integrating holistic care. The American Nurses Association standards of practice guided my nursing standards. This guided my clinical decision making. The standards ensured that interventions for his care were evidence based, individualized, and continuously evaluated for effectiveness. My interactions with patients and colleagues shaped the code of ethics. I upheld his right to participate in decisions about his rehabilitation, advocating for him when needed, and ensured that I maintained confidentiality and dignity in all aspects of his care. The last is regulations, practicing within the scope of my practice and adhering to the regulations of the state of Minnesota. This included medication administration, infection control, and safety protocols for the patient. I ensured holistic communication by practicing active listening and nonverbal cues, including maintaining good eye contact and using a tone of voice that conveyed empathy and presence. Family members were invited into the conversation about his rehabilitation goals, the home modifications that would be made, and long-term care planning, as well as what the Veterans Administration would provide for him. Communication was facilitated with the interdisciplinary team. His cultural values, spiritual beliefs, and personal preferences were consistently taken into account in all conversations. This helped to reinforce dignity and trust. So, for my self reflection, I feel that nursing is both an art and a science that I've come to appreciate through my clinical journey at St. Kate's. The science of nursing has guided me in developing an evidence based practice, adhering to standards of care, and employing clinical reasoning. It is the core of the nursing practice. The art of nursing is the trim of the nursing practice. It is how I have adapted care to the uniqueness of each patient I have cared for during my clinical experience and for future patients. I have embraced a healing presence as I continued on my journey, guided by the Caritas processes of Jean Watson. I have loving kindness, authentic presence, and a trust built with those I have cared for. Nursing is not just a profession, but a way of being a human caring scientist, artist, and a healing presence. So, in summary, in caring for my patient, I have embraced the unitary human caring approach by not just seeing him as a tetraplegic or a diagnosis, but someone who has resilience and has the potential for transformation in his journey. I see him as a person. He has been empowered by having decision making goals in his care. I have created a healing environment for him that fosters emotional and spiritual healing. For myself, I have experienced nursing as both a science and an art that integrates evidence based interventions with authentic caring. As a future RN, I will apply unitary human caring, fostering a healing environment, and practicing contemplative practices such as deep breathing and mindfulness. I will also serve as a mentor to other nurses throughout my career.